A lot of people ask me about selecting the right running shoe. And I would tell you that the first piece of advice I give is that most people will do well in a lightweight shoe. That means 12 ounces and ideally really under 10 ounces. A heavy shoe creates a lot of strain on the foot and can lead to things like tendonitis, overuse injuries, and even shin splints. Now the next question people have is, should they use a foot-specific shoe? Meaning, if you're an overpronator, should you be using a motion control shoe? Or if you're an underpronator or a high-arched foot, should you be using a structured cushioning type of shoe? Now, over the past few years, there's been a lot of good evidence that's come out that's shown that most people will do well in a neutral platform type of shoe. So something sort of in between that provides just the right amount of cushioning and just the right amount of stability. And there are many good shoes that fit this qualification available in most good running shoe outlets, usually that don't require a specific type of treadmill analysis for most patients. So when should you replace your shoes? About every 250 to 500 miles, and that means about every 3 to 6 months, depending on the frequency and the mileage and the distance that you're doing. Now, what I tell most of my patients is that when you think it's time to replace your shoe, it's time to replace your shoe. And a new pair of shoes is a good investment, as there is a lot of good evidence out there that shows that a worn out shoe can lead to injuries. So if you're not sure what type of shoe, come into the office. Usually I can give a good analysis of the foot and let you know what type and even steer you toward different brands which may be just right for your foot.